So my name is Mustafa Borahay, and I'm Associate Professor of Obstetrics and Gynecology in Johns Hopkins School of Medicine. I'm also the Director of the Division of General Obstetrics and Gynecology, and I'm also the Director of Minimally Invasive Gynecologic Surgery at Johns Hopkins Bayview Medical Center. I've been practicing obstetrics and gynecology for more than 20 years. With the pandemic and starting December 2020, when we started having the vaccination, I started seeing increase in abnormal bleeding or irregular bleeding, sometimes heavy, in some of the patients after the COVID infection, also noted after the vaccine. Even some women who have been menopausal for some time, it was very minimal bleeding that happened after menopause, also after they received the vaccine.
Let's talk about the study. So you last year received a grant from NIH to study the impact of the COVID vaccines on menstruation. Would you give us an overview of that study?
My group work is focused on answering these three questions. The first question is if there is any association between the COVID vaccine and abnormalities in menstruation in women. Second question is, if there is association, what's this, the nature of it? And the third, if there is association, what's causing it? So my group work has used three projects to answer this. The first is we partnered with one of the period tracking applications called Clue. We used the data that the app users have entered, and we send them survey on the date that they received the vaccine. And because we already have the data that has been collected, we matched the date of the vaccination with the pattern of their menstruation. The second project was a prospective study that we did it ourselves. It was web-based, national across the entire United States, and we created a website, covidmenses.org, where women who are going to receive the vaccine can go in and sign up, and each day they would get a text message from our group to ask about their menstruation, if they had bleeding, and if so, how heavy it is. And also once they get the vaccine, they record it. So this included some who had the first initial vaccination and others who had the boosters. And we also included controls who did not have the vaccine or the booster during the study. The third one is looking at the mechanism or the effect of the vaccine on endometrium. Endometrium is the inner lining of the uterus where the menstrual blood comes from.
I'm so interested to hear the results. Can you tell us a little bit more about the results?
So from the initial preliminary data analysis that we have done, it seems like there is some association between the vaccine and some menstrual irregularity in some of the participants here, which actually is somewhat similar to our observation in the clinic, which was anecdotal. There is some menstrual irregularity that happened during the month that the participant or the user received the vaccine. So sometimes the period was came later or earlier than expected, or the bleeding days was shorter or longer. What we have seen so far is it can go both ways. And obviously there is variation. So some had shorter period, others had longer. Some had the period coming before, and others noticed that it became delayed. What we also observed is that these changes were mostly in the month where the vaccine or the booster was received, or the month after it in most cases, which again, that supports our observation in the clinic that for those who had these observed these changes, it was vast majority of the time is self-limited, and it resolved and the period went back to normal after some time between 1 to 2 or 3 months. Vast majority it went back to normal after 1 month. Very few that it persisted more than this. And I would like to stress that this is in the minority of women who had changes. So when you look at the data that we have, the vast majority of the women who received the vaccine did not have any change. So it's a small fraction.
But then when you talk to certain people, and they're probably in the severe minority, there's some who have just had really extreme cases. Is that just a complete anomaly, or is it just not documented enough?
In science in general, there is this observation. We always look at the data from a statistical point of view. And if you look at what we call a distribution curve, there is always majority of the population. And then as you go toward the extremes, the number gets smaller and smaller. And if you try to do a study, you might not see these numbers because you will not study everyone. You study a sample, and the sample might not catch something that's it happens 1 in a million, for example, unless you have a study sample of 2 or 3 millions, which is not common. We see in our sample, which is in the study using the AB data, which is thousands. In the prospective study, it was hundreds. We see some cases that were more than 2 or 3 months. And I can expect or suspect that some women, maybe very few, maybe we're talking about extremely few, would have extreme cases, even though we don't see them on the studies that we do. But I can imagine that they are present in the community. And from a scientific standpoint, it's possible. And I think it's just the extreme tails of our distribution.
What's your theory as to what may cause the changes in their cycles?
Our theory is the COVID vaccine and possibly the infection itself affect the immune cells in the body. And because there are so many immune cells in the inner lining of the uterus, which we talked about earlier, called the endometrium. And many of these immune cells secrete lots of proteins and other mediators that regulate the shedding of the inner lining of the uterus, which is actually menstruation and the bleeding and the mechanism that stops the bleeding. So it's reasonable to hypothesize that changes in the immune response, whether to the infection or the vaccine, can affect the function of the inner lining of the uterus and therefore can affect the menstruation. But one of the interesting things that has been getting our attention, women get infection by many other viruses, and these other viruses also cause immune response. And it's not common that we observe abnormal bleeding or effect of menstruation after these other infections or the vaccinations. So women receive lots of vaccination. We don't frequently or barely, we don't see effect. We as scientists, that's very, very curious. We're very curious to figure out why this happened.
That is interesting. I thought you were going to say the opposite, and then you said what I didn't expect you to say. So that's really interesting that this virus seems to be having a more abnormal effect on menstruation than other viruses.
And what we're trying to do is we're trying to get both increase the public awareness of the importance of research focused on women's health and reproductive health, and also to increase the funding from the NIH and other funding organizations. Because without a rigorous research, we will not be able to answer these questions. So my answer to you is that we're just starting to learn.